Alia, do you think it would be okay to ask people to put in the chat where they're joining from, just so that we have a sense of which countries are here?
Yes, sure. I think once everyone is here, we will ask them to do that.
Thank you.
Thank you.
I see people are joining, so welcome everyone. Good afternoon, good morning, depends where you are. We're going to start in a few minutes, very briefly.
Hello, everyone. Thank you for joining us. We will start in 5 minutes maximum, just waiting for people to join. But if you can start writing, maybe your name, where you're coming from, maybe your organization, that would be really good. Thank you so much.
Good morning.
Good
Can you hear me?
morning. Good
Hello,
afternoon.
good morning, Ángela.
Good morning, good evening, good afternoon to everyone. I'm sorry for my slow connection, but I see already plenty of people are already joining the meeting. So I thank you so much for punctuality and for joining us today in this first introduction meeting and consultation we're happily organizing with our partners with FIG. Women for Global Fund is really happy and excited. First of all, let me start wishing you a happy new year 2025 and just reminding us our commitment and work towards gender equality and the comprehensive gender transformative HIV response. Thanks to everyone who is here. I see so many people here and happy to recall that Women for Global Fund is a global network of advocates from around 75 countries. We are primarily based in the Global South countries, and we are dedicated to promoting gender equality and equity around Global Fund programs and other health structures. And we are ensuring that these projects are gender sensitive and transformative, and that these are addressing the specific needs of women and girls in other diversity. And we're having these specific trainings and capacity building workshops and consultation to better understand what are these needs and challenges around the HIV comprehensive response. And today we have the amazing pleasure to have our partners here that are going to be presenting some important information around FGS. And just let me briefly introduce our partners. The FGS Integration Group is an innovative coalition of organizations galvanizing joint actions across sexual and reproductive health and rights. HIV, HPV, cervical cancer, neglected tropical diseases, and WASH sectors to tackle all this and have a comprehensive understanding of the needs of women and girls too. And this group is raising awareness of FGS with the aim of improving the diagnosis, treatment, prevention, and having sustainable responses and integration to FGS into sexual health and reproductive rights and NTD programs at different scales. So FIG is co-chaired by Frontline AIDS and the Unlimit Health. And in here we have the pleasure to have Yael Velleman, and also we have, let me see, we have Leora Pillay here also. So thanks for joining us. And my name again is Ángela. I'm the Global Coordinator of Women for Global Fund. And here I'm introducing also core team members of Women for Global Fund, Alia, Amimi, our Gender Advocacy Lead, who will be presenting afterwards. Our Communications Lead, Andrea Guillem. And we also have our National Focal Point from Malawi, Ethel, that she will be introducing herself a bit afterwards. Please, I think I will give the floor now to the FIG group to start the presentation, and we will be having also your, please, if you can introduce yourself in the chat with your country or where you're coming from, specifically in the context that you are working. It would be great to see in the chat all these amazing people joining us. And thanks again for being here present. So I don't know, the FIG group, please, if you can start. Thank you so much for being here today.
Thank you very much, Ángela. Very nice to be here. Thank you for the invitation to speak. And it's great to be part of this conversation with colleagues I can see on the chat from Malawi, from Tanzania, from Zambia, and others as well. So my name is Yael Velleman. I work as the Director of Policy and Innovation at Unlimit Health, and I'm a co-chair of the FGS Integration Group, together with Leora, who I will hand over to in the midst of this presentation. Hopefully we'll have a great discussion today, and we'll get started, and then there'll be plenty of time as well for questions and answers. So first and foremost, we just wanted to share a little bit of information about FGS, what it is, and why we feel that it's an important issue to engage with in the area of HIV prevention and support of the Global Fund. So FGS is a condition, a chronic, caused by a chronic infection with a parasite called Schistosoma hematobium. You may be more familiar with the name bilharzia. That's the disease that's caused by this parasite. And this particular form of the disease is a urogenital one. There are also intestinal forms as well. But without going into a lot of scientific detail, what tends to happen when women and girls have this parasitic infection, the worm that lives inside the bloodstream sheds eggs, and those eggs become deposited in tissues in the reproductive organs. So the uterus, the vaginal wall, the vulva, the cervix, and that causes a whole swathe of effects. So firstly, it causes symptoms that are quite similar to those caused by sexually transmitted infections, such as pain, discharge, discomfort, and contact bleeding, but also can result in much more serious complications, such as infertility and ectopic pregnancy. In terms of the scale of the problem, the World Health Organization estimates that about 56 million women and girls, mainly in the African continent, are affected by this condition. But we don't have a lot of data on this, and Leora will speak more about the link with HIV and other aspects. But in general, an important point to keep in mind about schistosomiasis or bilharzia overall is that it is a disease of poverty and vulnerability. So women and girls come into contact with this infection when they're having to use contaminated surface water, when they're fetching water, when they're bathing, when they're doing laundry, even when they're just swimming or crossing water streams. And the main control measure that has been put in place in many countries, I think pretty much all of the countries that are represented here today, has been mass drug administration with the donated drug praziquantel. Just to give you a sense of the burden, we have some information here from a subset of countries, including those who are here with us today. So the data that you can see on the left-hand side basically gives you a sense of how many people might be at risk of infection with this type of parasite. Of course, not all of these individuals are women or girls. Some of them are males, of course. And the division that we have here is between school-age children and adults. The reason that we've split up that data is because usually the prevention programs that I mentioned, the mass treatment with praziquantel, are directed specifically at school-age children. But as you can see from this data, that still leaves quite a significant number of adults who are usually not treated, and that includes female adults as well. And untreated infection of urogenital schistosomiasis is more likely to result in female genital schistosomiasis, which is what we're talking about today. On the right-hand side of the slide, we've just provided a little bit more information specifically for Malawi, as I know Malawi is our focus country of discussion today, and we'll hear more from Simon later on. What you can see in the graphs on the right-hand side is that most of the urogenital schistosomiasis infection in Malawi is considered to be either moderate prevalence or high prevalence. So actually pretty much the entire country in Malawi is affected by or is at risk of urogenital schistosomiasis, which means that we probably have quite a high burden of FGS as well. And there are studies taking place at the moment to quantify the burden of disease a bit more accurately in several countries, including Malawi, Tanzania, and Nigeria. I think on that note, I will hand over to Leora. Over to you, Leora.
Thanks so much, Yael. So FGS, because it creates lesions in the cervix and the vaginal tissue, has a very strong relationship with cervical cancer and HIV, which is particularly why we feel that there's a really, there's a strong importance of needing to include FGS in HIV prevention programs. There are some studies which have documented that FGS may be associated with a 3 to 4 times greater risk of HIV acquisition and transmission. And this is because of the immune response that the body activates when it's got an active schistosomiasis or bilharzia infection, but also because of the lesions within the vaginal tissue, which basically provide a hole that HIV can move into. Similarly, the constant mistreatment of FGS as an STI, which Yael explained, FGS often presents like an STI and looks exactly like that. Because healthcare workers are not aware, the clients are continuously given antibiotics, and this can result in a constant misdiagnosis and mistreatment, but can also ultimately result in antibiotic resistance because of the fact that they receive constant doses and treatment of antibiotics when it's not actually something that can be treated with antibiotics. There's also an association of FGS and HPV, obviously also because of the lesions in the vaginal tissue and the inflammation. There's an association between HPV acquisition when someone has FGS. And this is because FGS can increase the inflammation of the cervix, increases infection risk, and can affect the immune response to HPV infection, which can also result in quicker advancement into cervical cancer. So there's an HIV, HPV, and cervical cancer risk related to untreated FGS infections. The misdiagnosis as an STI and the associated reproductive complications can obviously lead to massive shame, stigmatization in the community, social exclusion, depression, isolation, and gender-based violence. And we know this all too well within HIV, that anything to do with sex or that part of your body is something that's not discussed. And a woman who may go back to the clinic multiple times for a recurring STI, when it's actually FGS, an untreated case of FGS, would most definitely be stigmatized and discriminated against within that community and within that clinic as someone who's promiscuous and possibly, not possibly sleeping around. And then that can also result in gender-based violence within a marriage or a relationship. So we've heard about why FGS is so, it's really, really harmful. And there's 56 million women and girls across Africa that are at risk of FGS. So why is FGS not being addressed? Next slide. So essentially, FGS is just unknown. People don't know about it. People don't talk about it. We all know about schistosomiasis and we know about bilharzia, but we don't know that a particular type of bilharzia or schistosomiasis can cause something called FGS. And this is largely due to the fact that there is no globally set normative and technical guidance that exists around female genital schistosomiasis. And this results in a lack of knowledge and awareness at the government level, as well as at the health system level. There's no data on the burden of FGS. There's no national guidelines and medical training. And because of this, there are no links to any other sectors which should be engaging in FGS work, such as SRH, HIV, and HPV. There's also a lack of, because of the fact that healthcare workers don't know about it, government doesn't know about it, communities themselves don't know that FGS can happen. There's a lack of access to FGS services and delivery. And there's a reliance on NTD programming, where we've got matched treatment of praziquantel being given out to within schools, etc. But there's also a lack of treatment within healthcare centers. There's a lack of the access to that medication within healthcare centers because people are not aware that FGS exists and needs to be treated. And there's constant misdiagnosis. So basically, FGS just remains clouded and unknown. And because of that, we don't have normative and technical guidance, and there's very little knowledge at community government and within the healthcare level. So the reason we're all here, next slide, is to talk about why does this matter and why should it matter to the Global Fund. The UNAIDS has developed a document of which the image was on the previous slide, called No More Neglect. So we do have international institutions recognizing that there is FGS and that there is a risk and a link to HIV. But why has this not sort of reached the Global Fund's radar? And why do we need to make sure that it matters to the Global Fund? Basically, because there are no normative guidelines, it's not yet reached the point of being funded within countries at large scale, because there's no and governments are not aware of it. But essentially, FGS should really matter to the Global Fund because it affects adolescent girls and young women, sex workers, and other female key populations at risk of or living with HIV. Essentially, all the important populations of women and girls and related key populations that the Global Fund reaches and wishes to reach to protect them from HIV or keep them healthy are at risk of FGS. Additionally, if we care about the whole woman, we shouldn't just be targeting FGS or HIV if it's done with Global Fund funding, but it should be targeting all the other related services that that woman or girl may need, such as HPV, cervical cancer, and it should include FGS. Because FGS results in an increased risk of HIV acquisition and invasive cervical cancer, this really should matter to the Global Fund because it is a risk factor for this population in many of the countries across Africa. A lot of the Global Fund programs are in countries that have a huge amount of schistosomiasis. And we have, if you look at the maps of schistosomiasis across these countries, you'll see a lot of the districts and the areas in which the Global Fund implements AGYW or key population programs have populations that you will see there's a large prevalence of schistosomiasis in. And so there's a large section of people within the populations that the Global Fund are taking care of related to HIV that are vulnerable for FGS. Additionally, FGS integration, so integrating FGS into HIV prevention screening and to SRH screening, similarly to how you would do cervical cancer, provides a practical model for achieving impact on health, education, economic empowerment, and most importantly, gender equality, while increasing the resilience and the sustainability of the whole health system and the community. And these are core components of what the Global Fund really cares about within a lot of the countries that they are funding programs in. So what we are asking and trying to advocate is that high quality and comprehensive HIV prevention services are included in Global Fund programs. High quality and comprehensive HIV prevention services, including FGS, must be part of Global Fund programs, reaching AGYW and key populations that are at risk or living with HIV within these areas and within the countries where FGS is a risk. And that a focus on FGS will really help to highlight in which healthcare where the healthcare system is failing women and girls, and really try and rectify that. Because FGS really should be seen as an entry point for improving quality, improving the quality of holistic HIV prevention services and improving trust in and uptake of these healthcare services. So I'm going to introduce someone called Simon Sikwese now. He is the Executive Director of Pakachere in Malawi. And Simon is a partner of Frontline AIDS and Unlimit Health, and has been working with us for a number of years on trying to advocate to get FGS on the radar within Malawi. And it all started with some advocacy in trying to get FGS into the Global Fund grant, with all of the elements that I've mentioned before, around the fact that FGS increases HIV risk and that Global Fund HIV prevention services to women and girls to truly achieve gender equality should include a holistic set of services. And so Simon, please take the group through some of the progress that's been achieved in Malawi, because there's been amazing progress which started due to your advocacy related to the Global Fund.
Thank you very much, Leora, and thank you everyone for joining this interesting discussion. I will take you through the work that Pakachere Institute of Health and Development Communication, a local NGO in Malawi, has undertaken to put FGS into the national guidelines. And we are hoping that this is going to be a learning curve that we can also start looking at to see how we can bring FGS as an issue that's going to be addressed because as it has been presented, it wears a very strong gender lens. And just to also underscore that there are some women who are suffering gender-based violence because their husbands could suspect that they have an STI. Yes, it is FGS. Because it is unknown, it is coming from bilharzia, which is one of the neglected tropical diseases. And we all know about these neglected tropical diseases because they don't have adequate funding. And as a result, there's a lot of suffering, especially among the poor people who are affected. Now, for us, when we were introduced to female genital schistosomiasis, and looking at how women, young girls, and female sex workers are suffering in silence, we took it upon ourselves as CSOs using our network, which is called Civil Society Advocacy Forum. We teamed up, more especially with the COLA, which is the Coalition of Women Living with HIV, to start advancing and looking at how FGS can go into the Global Fund proposal development process because we wanted it to be included in the Global Fund proposal during the round 7. We consulted a number of stakeholders, the academia, the National AIDS Commission, the Minister of Health, and various stakeholders. But what came out clear was that very few people, even in the ministry, knew what FGS is and how it is affecting women. And when we tried to push it through the Global Fund proposal, we met an obstacle because the Global Fund proposal in Malawi is based on the National Strategic Plan for HIV. And anything that goes into the Global Fund proposal is supposed to also be included in the NSP. And then sadly, FGS, schistosomiasis appears in our National Strategic Plan because it's an unknown area that people didn't know about. As a result, it fell off the proposal. So we continued our advocacy efforts looking at this challenge, where we now started talking still with the Minister of Health, specifically the Department of HIV and Viral Hepatitis, to also look at the possibility of still looking at available opportunities where we can ensure that FGS is integrated. So, like enough, during that time, the Department of HIV was in the process of reviewing the national STI guidelines for HIV, I meant for STIs and viral hepatitis. And one of the advice that we got from the ministry was that for any issue to be included in the national guidelines, the national strategies, it has to start with being included in the national guidelines, and then it finds its way into the other high-level strategic documents like the NSP. So we engaged with Department of HIV. We provided the evidence that has been generated in Malawi because during our consultations, the academia assisted us a lot because they have conducted studies in Malawi that has demonstrated that FGS is prevalent across the country. And one of the youngest girl that was found with FGS was 15 years old. And this is attributed to the fact that it is women who are mostly found working or drawing water from the rivers or doing other household chores in the rivers, which exposes them to bilharzia. So based on the evidence that we provided to the department, they invited us to a national stakeholder workshop where they were revising the guidelines, and then they gave us an opportunity to present our case on FGS with evidence. So we went to that meeting with the researchers from the University of Health Sciences and some gynecologists who presented the evidence and also presented on the opportunities for integration for FGS. Now, upon providing that evidence, it was so compelling to the participants that they found it very important and the need to make sure that FGS is included in the guidelines, but also ensuring that in other strategic documents, it must appear. And one of the key discussions was on how this was going to come out. And through the technical guidance from the team, we eventually ensured that the National Health Commission, the Minister of Health, and all participants were very, very eager to make sure that the revised STI guidelines for Malawi must include FGS. And as I'm talking now, we are actually celebrating and happy that FGS is now included in the national STI and viral hepatitis guidelines. And once this has finalized the approval processes, which takes a bit of time due to some technical issues, then it should be able to see itself in the NSP, but we can also include it in the other proposal like Global Fund or even PEPFAR, because now it's in the strategic documents. And then finally, on the next slide, you will note that this has already been highlighted, but one of the most important things that we had to emphasize on was to look at FGS being easily integrated in existing interventions that are being implemented, be it with the Global Fund or PEPFAR. If you look at the Global Fund and the key population programming, STI, cervical cancer, and HIV testing are integrated, and cervical cancer screening could also be combined with FGS, which means it would not demand as much money as people may think, but we may be looking at issues of now training the healthcare workers to be able to diagnose and know that this is an STI, this is cervical cancer, or this could be FGS, and provide the appropriate referral. And again, looking at how we can intensify campaigns to make sure that even the target audiences, the communities, should be aware of what bilharzia is and that it can translate into FGS, which can be misdiagnosed as an STI. And we also need to make sure that in the process, we are creating demand for praziquantel, which is used to treat schistosomiasis, because if it is treated early, then we prevent FGS, which again demands the need for praziquantel to be made available in the health facilities, because usually it's only available during mass drug administrations that are conducted once a year. And then finally, one other thing that we realized that we need to work with the Department of the Neglected Tropical Diseases, especially the officers involved in schistosomiasis, to make sure that there's a proper integration, networking, so that the integrated approach to addressing FGS is more effective. And for Malawi, I think we've taken this route and it is working, and we're hoping that in the next years to come, we have already started seeing interest from partners. So GIZ, for example, is going to be working on a pilot project in Malawi in 2 districts to look at an intervention that is going to address FGS. And they're working on the final work plan, which is going to be shared, and then it will be interesting to see how that is going to look like. So in brief, this is the progress that Malawi has so far made in ensuring that FGS is put as one of a risk factor that is affecting women, and we really need to do something about it. Thank you.
Thank you so much, Simon, and also to Yael and Leora for this presentations. I think it has been very informing and with lots of insights of what is happening in Malawi. I thank you also all our flourishers and national focal points from Malawi, Nigeria, Ghana, Tanzania, and Zambia to be here present. I know this is an interesting topic and many of you will have now lots of questions probably. So I will open the floor and probably hear from you, our advocates and flourishers and national focal points, to see if they have questions for our panelists. So if you have a question, please raise your hand, and I can see who is here. And also, like, every question is valid, every question is important. If you want to share also an experience you have encountered, if you have ever heard of FGS or you have not, this is also an opportunity to share your insights. And if you want to, please raise your hand, that would be amazing. Can I hear from you? Let me see. Hands raised. I think lots of information, right? But
hi, Angela. I would like to comment.
yes, please go ahead.
All right.
And
Thank you so
introduce
much.
yourself.
Pardon?
Can you please introduce yourself?
All right. Okay. I'm Linda P from Malawi. I'm part of the Women for Global Fund, Flourish group, but also I'm the Youth and HYW representative at Malawi Global Fund Country Coordinating Mechanism, CCM. So I wanted to comment on the what has been presented. I really love the topic. To be honest, I didn't really know about FGS. So when I received the email about FGS, so I was really curious and I Googled it on internet, and I figured that a lot of people here, they don't know about. I'm currently in college, but you can imagine from high school up to college, you don't know about FGS. But then after I Googled it, I kind of find out that it's affecting a lot of women and girls, and it is very crucial for every woman or for every girl, for every young person to know about FGS. So to comment on the lack of knowledge, it's very true that a lot of people, they don't know about FGS, and it's very important to conduct some awareness campaigns in the communities for people to know about FGS, because honestly, you cannot go to the hospital to get treatment for something that you don't know about. But also, as the presenter was presenting, to say that there are people in the health workers themselves, they don't know about FGS. I wanted to comment to say that I think our government we can also lobby the government to put this topic in the school curriculum, so that when the children are learning, when they learn it from. Hello? Am I audible enough?
Yes, we can hear you.
Yes, so to put it in short, I just wanted to comment to say that we can also lobby the government to put this topic into the school curriculum from secondary to university, so that in order to increase the demand, so that young people should also be demanding this treatment. I once went for cancer screening, and the presenter said that we can also incorporate this, that whenever you go for cervical cancer screening, you can also go for FGS screening, which is very important. And in that way, we can also minimize the problems that comes with FGS, because I've seen that if you are infected by this disease, it increases your chances of you getting STIs, it increases chances of you getting HIV, it also increases chances of you not to give birth, these are very crucial topics. But also I had a question to say that considering health priorities, I know that each country has their health priorities. For instance, in Malawi, the health priorities includes HIV and AIDS, includes malaria, includes TB and whatnot. So I wanted to ask to say how best can young women and girls lobby for this, like create awareness in order to make sure that everybody in the communities are able to know about FGS, because I feel like it's very important. Thank you so much.
Thank you so much for this important insights and question to the panelists. I think, as we have been saying, we know that this might be very unknown in the first time you are hearing about this topic, but this is the reason why we are here present. This is the reason why we're having this informative session. And I will just give the floor probably to the FIG group to answer these questions from Ethel. Thank you.
So I think I'll hand over to Yael, and Simon would also likely have something to add. But I think women, young girls and women really need to advocate to have FGS included related to HIV by really highlighting that link. I mean, we really need to highlight that, you know, programs that focus on HIV cannot focus on HIV alone. There's been a huge battle to get cervical cancer included in a lot of Global Fund HIV programs, and we already know in a lot of countries that's not even done as well as it could be and should be. And we know the very many battles, you know, related to priorities and funding which come into the conversation when you're discussing that. But I think, like on the country level, but I think the way, you know, women and girls can really advocate for FGS to be included is really by demonstrating that if the only way to achieve gender equality and ensure that we provide quality services to women and girls in all of these countries and look at them as a whole person and not just a vector of HIV or at risk of HIV, is to provide all the services which can either make them more at risk of contracting HIV or can make them at risk of getting more sick if already HIV positive. And I think that's the angle at which women and girls need to advocate in country. Similarly with cervical cancer, you know, we all know the risk if you're HIV positive and you get HPV, you can have a faster movement into invasive cervical cancer. And it's very similar here with FGS. FGS is silent, exactly like cervical cancer. And so I think it's just about women and girls really standing up and saying that this is a risk factor for HIV. It's a risk factor for invasive cervical cancer. And if we really want to achieve gender equality in these programs and not just do siloed HIV prevention services, we need to include all elements, including risk factors like FGS, which put these women and girls in such increased risk. A 3 to 4 times risk increase in getting HIV is huge. And it really should, it's not actually ethical. So, but let me hand over to Yael and Simon. They might want to add.
Thanks, Leora. I agree with everything you've said, and thank you so much for the comments and the question as well. I maybe just to emphasize that the last thing we want is to say that FGS is more important than other issues. And I think that sometimes when we advocate for specific issues, we have the risk of causing kind of competition between different health aspects. So what Leora said is absolutely correct. The demand should be for high quality, equitable services for women and girls, of which FGS should be a part, rather than adding it as a kind of separate issue. So that's what I would like to emphasize. And in terms of ensuring that it's included in the curriculum, that's a great point. And actually, I think that bilharzia is in general part of the curriculum in most countries that introduce mass treatment with praziquantel. It's just that FGS isn't included in that. So children are usually told, don't go in the water, take this drug to prevent schistosomiasis, but the awareness around FGS isn't added to that discussion. So that's something that we need to do. And then I think that we as a coalition, the FGS integration group, are working on other aspects together with the World Health Organization and other agencies in terms of the changes that we would like to see within the healthcare system, especially in terms of producing guidelines for ministries of health and for medical professionals to be able to properly identify FGS and incorporate it into the services. So there's still a lot of work that we need to do around that normative guidance. And we're hoping to be doing a lot more of that this year. Over to Simon and others.
Okay, thank you. But just briefly for me, in addition to what has been said, is also looking at FGS in terms of expanding the leaving no one behind concept, where we're looking at marginalized women who has got no voices. So we should be the voices, because one of the things that we have noted is that decisions regarding the health of marginalized women is made by other people who take time to recognize or appreciate what the women are undergoing. So you will see that when we are talking about trying to advocate about FGS, we are talking in the offices, but the woman is in the villages. So we need to be looking at how, from the question that Ethel asked, is look at how do we utilize the platforms, the forums that we have to amplify the voices, but also looking at gender not as a male to female issue, but within women, how can we support each other? Because when we're looking in the offices, you'd find women who would not maybe pay attention to look at, this is a woman's issue. Can I pay more attention so that I support my fellow woman who is suffering in the rural areas? And sometimes this has been at the expense of evidence. Yes, evidence is important. In FGS, we've got global evidence, sketchy national evidence, but it gives us a starting point to start doing something about the problem, while we're also generating more evidence to refine our approaches. So I think we need our voices in the various platforms. So if we sit in technical working groups, any forum that we meet, we need to make sure that we bring FGS. And this is one of the strategies that has helped us to make sure that FGS now sits in some of the most important national guidelines. Thank you.
Thank you, Simon, Yael, and Leora, for these important insights and answers to the questions on how strategies and advocacy and evidence information can guide this inclusion of FGS into comprehensive HIV services and comprehensive services for women's health. I will give the word now to Kimi for the question.
Hi, everyone. I'm Kimi Wangila from Women for Global Health Flourishing Group. One of the points which I wanted to add is actually not a question, it's a comment. I just wanted to comment to say, actually, we can also make use of flourishing groups, because there's a lot of young women who are actually allocated in different groups, which some of them actually exist in all parts of, we can say, I'm speaking in the perspective of Malawi, all parts of Malawi, local as well as urban areas. So this issue actually needs to be given a platform where it should be talked much and everyone should get educated as well. And also we should put it in an essence to say that it's also part of the rights, because when we're talking about FGS, we are also talking about the sexual reproductive health rights, which every woman has to have it on their own, because a lot of women are being hindered not knowing the information just because they are not aware that it's their right. Plus also with our cultural beliefs and other things which are actually hindering us in the communities, is also creating a very huge impact, so that we should not be having the knowledge. Because when you talk about issues of FGS as well as the cervical cancer, it has been a myth so far, and a lot of us were being educated now. So at least if we can be linking it to the rights, as well as to the answers, to say that everyone has to have this chance of learning this with the use of the flourishing group and other existing groups, that will actually be a great thing, because we're also talking of not only talking within us, but bringing it to the community. So at least if we can make a continuous conversation on it, it would be very great. Thank you.
Thank you so much, Kimi, for this important insight. And of course, we are in this group together to keep on mobilizing flourishers and advocacy from the youth, specifically to keep on disseminating the information and keep us informed. I will take now the question from Deborah.
Hello, everyone. My name is Mama Deborah Samuel. I'm from Nigeria. I'm the youth alternate representative of the CCM. So just a quick one here. It's my first time hearing about FGS, and it's very insightful and educating. So I have a comment and also a question. My comment is, yes, we have received the knowledge. What next, yes, is to disseminate this information, this knowledge to our peer groups, to our small initiative, innovative approaches to our organizations and our network. So I am YPP focal person here in Nigeria, and YPP is Young People's Program. What we do more of STI referrals and also HIV prevention. It will be good if we include, or I include, this information to the peers. We deal with young people in secondary schools, young people in high institution in the universities. So my question is there any manual, is there any module, is there any guide on this FGS in which we can use to help guide us to pass this information to young people? Thank you.
Thank you so much, Deborah. I will just hold your question on for a minute, because Alia will be talking about some guidelines, some information, some documents. And just to remind, all this information, the webinar, the presentations, and some additional resources will be shared in the digital dossier, and we'll be sharing in the minutes of this meeting. So Alia will be presenting, and then we will be having some additional questions from your side. But before that, I might take the questions from Agnes. Are you still there? Yes, Edor?
Hello. Yes, I
Go
am.
ahead.
Hello, my name is Agnes Ochanya Edo. Can you hear me?
Yes.
Okay, so I'm a sexual reproductive health and rights advocate in Nigeria, and I'm also a member of the Global Fund for Women for Global Fund. So my question is, because the network was kind of bad and I was unable to get some parts of the session, but I would really love to know how to differentiate the schistosomiasis from other genital from other symptoms of the female genitalia. And then I want to know if there are currently prevention, or if there are rather treatments for schistosomiasis, and if not, if there are measures to manage schistosomiasis. And also, just to add up to what Deborah and other persons have said, it would really be nice if we as advocates from our different communities and different platforms, if we're able to push for the schistosomiasis, because I know under the Ministry of Health for Nigeria, for example, they have an NCDs department which a part of it covers schistosomiasis, but basically what they do mostly is conduct field activities and all that. So it would be nice if if advocates and young persons in different platforms, like I said earlier, are able to push for the advocacies and the awareness of schistosomiasis, because I mean, you are only able to prevent what you know, and that would really go a really long way if these meetings like this, webinars like this are made available for other young persons, not just specific number of persons, but a wider range of young persons and other individuals that are both working in the health sector and in the community spaces. So thank you so much, and over.
Thank you so much. Just so for my matter of time, I will give briefly the word to the FIG group to answer this question quickly. Maybe, I don't know, maybe Yael or Leora, you have to answer this question, and then we'll give the word to Alia so she can continue with the presentation.
Thank you. So very, very quickly on diagnosis is difficult. So you asked about distinguishing between FGS symptoms and STI symptoms. Diagnostics are quite invasive and require polkoscopy, which is not available in a lot of rural health facilities. So I think what has been done as much as possible is to at least kind of raise FGS as a potential reason for the symptoms, especially if the woman or the girl who's presenting with the symptoms comes into contact with surface water. And then the treatment at the moment is limited to praziquantel, which we've mentioned several times. That drug kills the adult worms in the body and has the potential to reduce the severity of the infection. However, once the lesions are very well developed, there's not a lot that can be done by that point. And that is why availability of praziquantel in healthcare settings, as Simon has mentioned, and through mass drug administration is so crucial. However, also just to mention that there are going to be several technical meetings this year run by the WHO to help address the gap in diagnostics and treatment. And then just to also mention, Leora is messaging me separately to remind me that there is an FGS society in Nigeria, and that is coordinated by Dr. Ibrahim Rabiu. And we also have a partner, a FIG member called Sightsavers, who are working on FGS in Nigeria. So maybe we can share those contact details with you after this, this webinar. Thank you.
Thank you so much for this question. I will give just in the chat information on what praziquantel is, just for further information. Maybe you can share what this drug works and how this works, probably on the chat. Ethel, I will just hold your question on for the next question and answer session. We will have still time for discussion. Thank you so much for this engagement. Alia, can you please go ahead with your presentation? Thank you very much. Alia is our gender advocacy lead. She's based in Morocco.
Thank you so much, Ángela. Can you see my screen? Okay. Okay. Thank you so much for your presence today, and thank you for our partners from FIG for the very interesting presentations and all the information that they have shared. I guess that they really addressed the why we should work on FGS. From our side, Women for Global Fund, it will be more about how we can advocate for the integration of FGS in the HIV services, and especially in the Global Fund modular framework. So just for the new participants and flourishers who don't know us, Women for Global Fund is a global movement of women's advocates that are working to advance gender equality through the global funds to fight HIV, TB, and malaria. So we are working with women in all their diversity to ensure that the Global Fund investments and grants supports programs that really meet the needs and priorities of women and girls, and also to catalyze the power of women in all their diversity to advance gender equality through the Global Fund. And we are ensuring that women's voices are taken into considerations in decision-making spaces at global, regional, at national level, and also to make sure that the Global Fund grants are spent to, achieve gender equality and to have the greatest impact for communities. So what do we mean when we say we work with women in all diversity? It means that we are welcoming all women. It includes women living with HIV, TB, and malaria. We are also collaborating and supporting women who identify as heterosexual, lesbians, bisexual, transgender, intersex, non-binary, women who use drugs. And if you can see here, we are working and supporting women, from different backgrounds, and we're trying to support programs for women who use drugs, for sex workers, and also transgender. If you take a look at our main actions, it's really done to ensure that women and girls are really engaged in decision-making processes, and especially the Global Fund decision-making processes, which include the CCMs, and during the different steps of preparing the funding request, the granting making, but also the grant implementations. And we want to make sure that the participation of women is informed, representative, and reflected in the outcomes of the HIV, TB, and the malaria response. So thank you for sharing all this information about FGS, but here we want to have this clear link between FGS and HIV, and why we need to integrate it into HIV services. It's first because FGS increases the susceptibility to HIV transmissions, and both HIV and FGS are disproportionately affecting vulnerable women and girls. So if HIV and FGS are both sharing the same barriers, which is gender-based violence, stigma, and discrimination that women and girls are facing. Also limited access to sexual and reproductive health services, and gaps in healthcare provider trainings in the different contexts that we saw with our partners FIG. So there is a real opportunity to leverage HIV services platforms to address FGS as a critical sexual and reproductive health issue. So why and how can we integrate FGS in the Global Fund modular framework? First, I would like to present the modular framework handbook that the Global Fund has developed for the previous grant cycle, the grant cycle 7. So the modular framework is actually a guidance document that the Global Fund has produced for all the countries that are submitting their funding request. And it actually provides the standards modules, the interventions, and the performance indicators that are supporting in the development of the funding request that will be submitted to the Global Fund. So it also gives indications on the categories of activities, so how to classify all the activities that will be funded by the Global Fund under these standards categories. So you can interventions in the module of treatment, the module of system strengthenings, and also the care modules. Also, you will find an actual structure to design the Global Fund supported programs for the countries and for the SRs, the CCM members that are working to prepare the funding request. And it is a guidance document that is prioritizing gender transformative programming. So how can we make sure, to integrate FGS into HIV services is to advocate for the inclusion of, for example, screening for FGS during HIV testing and counseling. We can also advocate for training healthcare providers to identify and manage FGS, and also to add FGS in the prevention and treatment module as a component of the sexual and reproductive services. One of the documents that Women for Global Fund has produced is the guide to navigate the grant cycle 7, but it can be applicable for the 8 replenishment as well, because this guide is developed to support women in all their diversity in understanding the Global Fund processes and to make sure that they include their priorities and their needs, and the gender transformative priorities in the national priorities. So it also aims to make sure that women are central to decision making, and that the funding requests that will be submitted to the Global Fund address all the structural barriers, the inequalities, and the gender-specific challenges that women and girls are facing. So you will find the descriptions of the different processes and steps to submit the funding request. You will have practical tools, examples on how to engage with key stakeholders, on how to conduct gender assessment that I will present now, and also how to align the funding proposal with the evidence-based, gender-focused interventions that will address the women's and girls' needs in the funding request. So all these documents are available on our website, and our team will make sure to send to all the participants today the link to access the guide and also the Global Fund Modular Framework Handbook. So the gender assessment is an initiative that was launched by UNAIDS in 2010. So it's actually a way to support evidence-informed planning and budgeting for gender transformative HIV response. And it's a tool that was developed by UNAIDS to support countries in better understanding how gender inequalities are shaping the HIV response in their own local context, and how gender-related barriers really hinder access to HIV services. Also to understand how well national HIV responses are addressing the inequality to meet the needs of women and girls, especially women from key and vulnerable populations like sex workers, transgender women, women who use drugs, women with disabilities. So it's really important to make sure that to know first if your country has conducted the gender assessment or not, and to make sure to advocate to have this gender assessment as an evidence informed planning and budgeting for the gender transformative HIV response. So this gender assessment will be the main tool that will highlight the underserved needs of women and girls that are affected by FGS. So women and girls who are members of the CCMs or representative of constituencies at the CCMs should advocate to push for gender assessments and to make sure to assess the access to SRHR and HIV services for FGS affected populations. And also gender assessment will be a way to document the discriminations and stigma that women are facing, and also its impact on the health-seeking behaviors, and also to finally advocate for the inclusion of FGS in the Global Fund funding request. So if you advocate for a gender assessment, you will be able actually to influence the National Strategic Plan, which is the NSP. And this way, you will also be able to influence the Global Fund grant, because it is based on the National Strategic Plan. So once you include and you integrate FGS as part of the HIV services, you can start advocating for more fundings towards FGS related services. So what happens after conducting a gender assessment in your country? So you will be able, like I said, to recommend interventions in the Global Fund concept notes and also in the Global Fund budget that your country will submit. You will also be able to mobilize additional resources for FGS. It can be included in the Global Fund or for any other donors interested in working and in the FGS response. And you will also be able to share and disseminate the gender assessment report, and it includes a summary table of interventions that can be funded, and you can share it with the stakeholders that are working in the field of HIV programs, and also to create more awareness about FGS and the implementation of the recommended HIV interventions. So what kind of interventions that you can advocate for related to FGS HIV integrated actions? You can advocate for a community-based education on FGS and to have it linked to HIV. Also, we can have a combined FGS and HIV prevention campaigns that are targeting young women and girls. Also, we can have this multi-sectoral collaborations between sexual and reproductive health, water, sanitation, and hygiene, and also the neglected tropical diseases like we have presented before with all these sectors. And you can also align with the Global Fund priorities for the AIDS replenishment as well, which is to focus on AGYW, to really also work on strengthening health systems with the gender lens, and to maybe think. Sorry, can you mute yourself? Thank you. And you can also think about conducting community-led monitoring initiatives and the community-based HIV services to identify FGS programming. So I saw in the chat that we have some CCM members that are part of this meeting. So I wanted to inform you about a guide that Women for Global Fund has produced recently. This is the most recent guide that we have produced for CCM members. So we are given a tool to help new CCM members to become really effective CCM members, to understand the CCM dynamic, to build alliances, and also it's a way to strategically push for FGS to be prioritized in the Global Fund grants in your countries, and especially in the HIV and SRHR programming. So through this guide, so you have 10 different steps. You can know how decisions are made within the CCM, who are the main key stakeholders, with whom you have to really create and build alliances, and how you can use your knowledge to identify the entry points to work and advocate for FGS as a critical issue linked to HIV and SRHR. So I will invite you to really check this guide. If you are a CCM member, it will be very helpful for you. And if you know a new CCM member, we will invite you to disseminate it, because it's really critical to know how the CCM functions, so that you ensure that the budget is allocated to FGS, to HIV, and to women's and girls' priorities. We have other resources that we developed last year. One of them is this key resources document for gender transformative advocacy. So we have created this tool to, summarize all the documents that we have produced, the guides, the posters, the policy and advocacy briefs, our toolkits, and our reports. So you can use this kind of information to advocate. And you can, for example, read the Women for Global Fund Accountability Toolkit to learn how you can implement community-led monitoring initiatives in your countries. If you are interested in having a FGS community-led monitoring, you can get more information about this. And you have the digital dossier that is available on our website, where you will get, a repository of documents and key resources that we have produced for the grant cycle 7 and for other thematics as well. And we just conducted and finalized our gender backlash report. Actually, it's a report that will be analyzing the evolving state of women and girls in all their diversity, rights and gender equality in relations to HIV, TB, and malaria, and linked to the Global Fund. So this report will be launched very soon. So I will invite you to also attend the webinar that we'll be conducting to get more information about HIV services and to think together about how we can integrate FGS in HIV services. So I think we have to keep in mind some key advocacy messages for FGS in the Global Fund grants, which are that we need to position FGS as a neglected SRHR and HIV risk factor. Second thing is that we need to push for FGS inclusion in the Global Fund funding request under SRHR and HIV models. And finally, to emphasize the sustainable integration of FGS services into the existing programs of the Global Fund in your country. So we need to make sure that there is FGS services included or not before starting this advocacy for the inclusion of FGS services. And the tools that you can use is, like we said before, the gender assessment and some program evaluations, but also some country case studies on the successful integration of FGS in SRHR services. And I think our colleagues from FIG can also share these kind of country case studies to know how, they were able to integrate FGS services in HIV services and also SRHR. Finally, I think we need to work together. We need to really join our forces to be able to advocate for FGS integrations. And we need to make sure that we use the gender assessment as one of the main tools to spotlight FGS related gaps. And finally, we are here to support you as Women for Global Fund and also our partners from FIG to strengthen this advocacy effort. We will be here to give you more information about FGS, to make sure that you are linked to the main stakeholders and you have all the tools and documentations necessary for enhancing the visibility of FGS and making sure that to improve, health outcomes for women in all their diversity. And I will invite you to follow us, on our social media to make sure that you receive all the documents that we are producing and also the documents that our partners are sharing with us from FIG. And we'll make sure to send you everything needed to, know more about FGS. Thank you so much.
Thank you so much, Alia, for this presentation. And I also thank all the participants for staying. I know we are staying a bit longer, but I know this is the first session we are conducting around FGS, and the link around HIV, cervical cancer, HPV, gender-based violence. There are plenty of integrations and intersections that we need to address. And I want to open this space for comments and questions of the audience. Alia might need to leave now for another meeting, but we will stay here also. So thank you, Alia, for joining. I and Andrea will be also answering to your questions, same as Yael and Leora. We have this space for dialogue and more questions. So please raise your hand if you have comments. I will give you the word now to Ethel as you can continue, please.
Thank you. Hi, everyone. My name is Ethel from Malawi. I'll get straight to it. So a lot has been said from the first presenters to now, but I've not heard anything to do with menstrual hygiene management. For me, it might seem a bit obvious, maybe to some of us, but I'll just also try to introduce a link between the three and why I think it might be important for partners to look at it a different way. First of all, I would like to say menstruation is a normal and a healthy occurrence that happens to most of the women, not everyone, but most of the women. And also, women spend 7 years, an average of 7 years menstruating, according to a health study by UNICEF. Why am I bringing up menstruation now? So menstruation, if I were to link it to FGS and HIV, it suffers the same, I would say, symptoms as some of the issues that we're discussing now. The same poverty that is discussed when we're discussing FGS and HIV is also the same poverty that is being faced with menstrual hygiene management. So it's very important for us to look at it that way, because the same problems that we're facing with lack of dialogue with menstrual hygiene management is the same PGS. Right now, most of us don't remember discussing menstrual hygiene management at home or at school or even in a place of work. I also see, I see the same problem happening in a place of work discussing FGS, because people don't really want to discuss issues that pertain to women's reproductive system, men's as well. But if we talk about sexually transmitted infection, menstruation, and FGS, I don't see how people would be able to open up if they're not able to open up about a natural occurring thing as menstruation. So it's just a plea to stakeholders attending the meeting, but also the different girls coming from different backgrounds, to start talking about menstrual hygiene management as a natural thing. And then we'll start looking at issues affecting women's reproductive health as also something that happens in our community, and it's safe to talk about it. So Russell Stothart et al. Discussed in research that they did, they discussed menstrual hygiene and FGS as being linked, but they said an effective way of dealing with FGS is also trying to link with other having a multisectoral approach with other issues that women face. So that is HIV as well as menstrual hygiene issues that we're facing, because we cannot deal with issues affecting women's reproductive health without dealing with the natural occurrence that actually happens every other time. So why am I bringing it up now is because partners should put the same effort that we've talked about, because I've not heard about menstruation, and which brings me to say it again and again, that also highlights how we exclude it in our discussion, and we shouldn't. It doesn't have to be like that. Even when we are talking about it in a place of school, we should also aim to integrate discussions around menstrual hygiene management, because the same vulnerability that women go through when they're experiencing menstruation is also something that we're going to find in issues of FGS. And we also start trying to integrate them in programs of, if we say when we're discussing FGS, there should also be a funding that is addressing lack of information for women and girls when it comes to menstruation, we'll find that there'll be a lot of dialogue and we'll be able to link it. And maybe one day we'll be able to talk about it the same way we talk about HIV being a serious issue today. So that is what I wanted to talk about. Thank you. But my question was, now, maybe there's a chance that maybe menstruation has been linked and hasn't been discussed. This is a question to Simon, because I know you deal with a lot of key workers in your programs. How do you link menstrual hygiene management to issues of women every day? And for Women for Global Fund, is there a chance that menstrual hygiene is discussed but was not discussed in this meeting? I think I'll end there for now. Thank you very much.
Thank you so much, Ethel, for your presentation of this important topic that we can discuss. Just from our side, I think it's really key, as we have always been trying to address the comprehensive needs of women in all diversity, and this of course includes the linkage with HIV, TB, and malaria services, but more about like specific disease components. We are always advocating and always working towards this person-centered needs, which is the kind of work we are always supporting and integrating, menstrual hygiene, FGS, HIV, gender-based violence, cervical cancer. I mean, there are an infinite list of topics and issues that we as women are facing and that we need a comprehensive understanding in it. So that's why documents, advocacy, evidence, information is very key for us to keep on advocating on women needs and challenges and how we can address those things comprehensively and use the Global Fund with its services as entry points, as also the FIG group indicated, as entry points to have these comprehensive services for women in all the diversity. And importantly, as also Yael mentioned, I think what we are all advocating here is to have comprehensive human rights, gender transformative approaches, and we're not aiming to compete among priorities, which tend to be sometimes the trend in some CCM groups and also in the national health systems. So why we're advocating for this is to have comprehensive understandings and views. I probably will give the few, I will take Simon, if you are still there, maybe you can answer Ethel's question and then we can go to the next one.
Okay. Thank you very much, Angela, and thank you, Ethel, for the presentation on the link between menstrual hygiene and FGS. I would be frank to say, I think our focus has mostly been looking at mostly FGS, HIV, and SRHR integration. But as you're rightly putting it, menstrual hygiene forms also part and parcel of SRHR. And maybe this is an opportunity that we need to explore because as the world is talking about integration, we also need to make sure that if there are opportunities, I think we also need to bring in issues of menstrual hygiene as they relate to FGS and the other SRHR issues. So I think from the presentation from Alia, I think you see that I think she has provided guidance in terms of how, where, and how we can advocate to include the FGS. So we need to be maybe talking about these narratives when you're looking at FGS integration, but also now how do we bring in the issues of menstrual hygiene because they mostly affect young girls, especially those in the marginalized communities. So a point that we're going to take up and continue discussing. Thank you.
Thank you so much, Simon, for this, for your answer. I think there's a lot of conversation still that we need to keep on going. And of course, this is the first meeting we're having. We aim to have more conversation and more spaces for dialogue and further advocacy. I will give now the floor to Ebere. Can you please go ahead?
Okay. Good day, everyone.
Good day.
Good day, everyone.
I think, Ebere, you are mute. Good morning. Good morning, good evening. We can hear you. Go ahead, please. I think you're mute. I think probably Ebere has some connection problems. Okay, okay.
Can you hear me now? Can you hear me now?
Yes, we can hear you. Go ahead.
Okay. So my concern is on in-school adolescent girls, how to integrate FGS into the curriculum of the in-school adolescent girls, in the sense that we are targeting community sensitization for out-of-school adolescent girls, awareness, community awareness, dialogue, and the rest of them for out of school. So my concern in Nigeria, we already have family life and HIV education in Nigeria, which is ongoing in schools for in-school adolescent girls. So how do we? I think Women for Global Fund Nigeria should pilot the integration of FGS into the family life and HIV education that already exists in Nigeria, by informing the partners and key stakeholders, maybe call for a meeting and see how we integrate it, because the in-school adolescents are futures of tomorrow. So the more they're aware of HIV, GBV, SRHR, and cervical cancer issues and how to go about it, the better for us and for the future. So thank you very much. This is the concern I have. Thank you very much.
Thank you for this important comment and question. Also, I think why we are starting this is the first initial meetings. Then we will have also, I called for you to contact your national focal points in the countries in Zambia, Nigeria, Malawi, Ghana, and Tanzania. So we can also be putting more specific meetings and have also more information disseminated to our advocates and flourishers, and that we can build specific strategies for countries. We will be sharing also all the documents that were presented by Alia, which will be the key tools that we are aiming for you to use and disseminate also among your partners, so we can build advocacy strategies. And alongside the FIG group, we are very excited to support you technically, as we can see what are the contexts, what are the challenges, what are the specific needs in the countries, and see how we can all together base strategies, advocacy strategies within the CCM, but also with that non-CCM members that are willing to participate in the dialogues and that have a voice in the community health services and community organization that you are representing here. So this is the first initial step, but we are going to be working all this year in this topic, and happy to also have our partners supporting all of this network of women advocates in all the diversity. I know that we have passed a bit of the time, but probably I will want to, if there's any other concern, if there's other question you want to raise, if there's anything else you want to know, probably we want to hear also from you. If you want to share now or later, also through the chat or in the WhatsApp groups we have with the Flourisher groups, if you have other concerns, questions, it's always welcome to hear from you. And probably I will give now the floor to, I see another one, another question before we pass to the FIG group. Can you go ahead, Malumbo? Yes, you have the floor, Malumbo. Okay. Until we hear from Malumbo, can you go ahead, Linda?
Thank you so much. I'm Linda Piri from Malawi. I think I already introduced myself, but I used someone's link, so it was not portraying Linda, it was portraying Ethel. I think that's a technical fault. I wanted to comment on proper diagnosis of the FGS. Training of the health workers, I feel like it's very important, not just training them in for them to know about the FGS, but also they have to be trained on how they can help people live, young women and girls that are living with disabilities, because I haven't heard that. Most of the times, young women and girls that are living with disabilities, most of the times when we are talking about pressing issues, they are neglected. So I wanted to comment on to say that that we also need to focus on that by making sure that as health workers are being trained, they also need to be trained on how they can help young girls and women that are living with disabilities. We had this other issue, especially here in Malawi, whereby the doctor, he was in the hospital, and when a patient who was a young woman living with disabilities went on to get treatment for STIs, but because they did not they were unable to communicate, it was really hard for the doctor to treat the person. And at the end of the day, the young women with living with disabilities, she ended up getting a wrong treatment because there was a miscommunication. So I feel like training the health workers, especially on how they can treat or on how they can communicate with people that are living with disabilities, is also crucial in as far as we want to address FGS. I think it's very important, and it's the issue that most of the times we neglect it. But also I wanted to comment on to say that I would like to thank the Women for Global Fund for developing a tool that can help the newly selected CCM members. Being a CCM member is not easy, especially in Africa, because I can also talk in the sense of Malawi. You find out that you're a CCM member, you don't know what is happening, but also the words that are there, you talk of principal recipient. So if you have never heard of Global Fund, or if you don't know anything about Global Fund, it's really hard for you to know. It's really hard for you to well represent your constituency. And I'm sure that the tool is going to help us, because I'm also a member of I'm the youth and HYW representative at Malawi Global Fund Country Coordinating Mechanism, which is CCM in Malawi. So I feel like it's going to also help me a lot. When I first joined, it was really hard for me. Like, I was really finding it difficult to grasp the information. So you've also been there. You were also helping me, but I really would like to thank you for developing this tool. I'm sure it's not going to help me only, but it's also going to help me. It's also going to help other young women that are representing adolescent girls and young women. But also I wanted to comment on the budgeting. Budget allocation is also crucial in Malawi. We are talking of FGS. I heard Simon was complaining to say FGS was not incorporated when we were developing funding request in 2022. I think it's because the them issue problem is still there. It's because it's a women issue, it's a girl issue, and in the decision making tables, there are not only girls, and also girls are underrepresented. So when you are representing issues concerning young girls and young women, and then men will be like, it's the girls' issue, why should we incorporate it and whatnot? So it's underrated. That's what I'm trying to say. So I wanted to put a question to say, how can movements like Women for Global Fund effectively advocate for increased funding and prioritization of FGS in global health programming? I feel like it's very important. Thank you so much.
Thank you so much, Linda, for these important insights. We are taking notes around budget, training of health workers, women living with disabilities. All these topics are key. And I think also our FIG partners are listening to this in order to make more comprehensive and integrated approaches for the actions we're trying to conduct. in terms of the budgeting, I think it's really key, and evidence-based information is important and fundamental to advocate for more budgeting to women organizations and to women needs and challenges on the Global Fund programming. All these specificities of how to do it, you can find it also in the mechanism, the tools, and the guides. But it's always important to also share this information with other partners. And for example, here we have the pleasure to have different countries. So sharing these lessons, advocating and understanding what others have also done to include those priorities into the granting cycle, it's very important. We are supporting through mentorship programs. We are supporting through the generation of evidence-based information. And it's really key that we all together advocate for gender assessment to be conducted. So we have all the baseline and the information ground so that we can put into the meetings and dialogues in the CCM, but also in the other meetings, because we need to put all these elements in the discussion also with health authorities and decision makers in the countries. I think this, we will give also a space for the FIG group to answer these questions, but probably will just take these two last questions from Malumbo and Natasha, and then I will give the floor to the FIG, to Leora and Yael, that they can comment on this. So Natasha, can you go ahead with your questions, and also Malumbo with the question, and then we can go to the last session of comments from the FIG group.
Thank you so much. Good afternoon. Can you hear me?
Yes, we can hear you.
Awesome. Thank you so much. So my name is Natasha Seketa from Zambia. First of all, I must mention that this has been a very insightful session. This is the first time I am interacting with the topic around FGS. So this has really been very, very insightful and very informative. My comment is really just very brief. I think we would notice that when Simon was giving his presentation, he talked about the importance of evidence-based research for them to include the aspect of FSG in the national strategic plans. So I just wanted to find out, I know it's possible for me to just search the internet, especially when we're looking at being advocates, even in the different spaces that we belong to. It's very important that we are doing evidence-based or research-based advocacy. So it's very possible for me to just search the internet and find maybe researches that have been done from a country context for Zambia, but I just want to find out if it's possible for the team to even share particular researches that have been done in different specific country contexts, so that even as we are continuing to learn about FSG and even to speak about it in these different spaces like technical working groups, we're actually giving the right information, right statistics from accurate research-based evidence. So I just wanted to find out if it's possible for links to some of these researches that have been done, especially for Zambia. I would be grateful if that could be done. Thank you so much.
Thank you, Natasha. We're taking your question and we're passing it through also to the FIG group. Malumbo, do you have any other comment or questions?
Hi.
Go ahead.
Hello, everyone. Yes. So I'm Malumbo from Malawi. Actually, my part is just to comment. I remember when Linda was trying to comment on, she commented something on concerning the curriculum. To say what if we incorporate that into the curriculum based, especially in higher education as well as secondary education, that is. So I was looking at this one thing to say, what about those people who dropped out of school? So I was looking into that to say, what about those people who are dropped out of school? How will they get access into this kind of information? So my part was, what if we also include it in terms of programs, especially to those, let's say we talk of social media like radios, we talk of TV programs as well as internet, whereby for those who have that capacity of accessing into internet, they can do so. But we're also looking into those people who cannot access that on the internet, especially now we're talking about the people who are living in the typical areas where we cannot reach them out to at least to give them that kind of an awareness, teach them here, to teach them this kind of information. So to my part, I was thinking, what if we come up with some programs that we talk of radios where our friends who are living in typical areas, they can also access that kind of information. Thank you so much.
Great comment. And I think it's very important that you mentioned also the importance of including this into school programming, into other mechanism workshops, capacity building, information, and also social media. Social media, I think, is also a key strategy, allowing people also, I mean, having better strategies and information to disseminate this concern in rural areas and remote areas. Very, very key and important. Thank you so much for this comment. Probably I can give the floor now to the FIG group so they can comment generally on what they have heard from you and what can be probably the next steps. I think that you have also shared some information on the chat, and we will be sharing all these documents and additional resources through the meeting report that will be shared with all of you. So Leora, Yael, Simon, the floor is yours.
Okay, thank you very much. Let me start briefly on the issues that I picked. Firstly, on the issue regarding how women for Global Fund can advocate for funding. I think that can be taken, but just to mention that within that advocacy approach, we also need to understand how country level budget allocations to the various thematic areas do happen, because for Malawi we have a challenge that over 80 or 90% of the Global Fund money goes towards the procurement of drugs, and very little goes towards implementation. So we really need to do a good work to convince the decision makers on how this allocation has to be made. That's why I was very interested, I think, when somebody was mentioning regarding the challenges that CCM members face to understand the process, because they make the decision. So if we have more women in the CCM and they're empowered with the information, it should be easy for the CCM to push decisions regarding pushing more funding to make sure that there's balanced funding across the Global Fund programmatic areas. On the issue regarding evidence, I think, yes, evidence is there. Studies have been done globally, regionally, but also in country. For example, in Malawi and Zambia, I know of some studies. I think these can be shared. But the other thing that I wanted to mention is that I think let's also engage gynecologists in the hospitals, because they also have lived experiences of instances where they've met women with FGS, very complicated cases, and they also have documented or anecdotal evidence on existence of FGS in our countries. And then finally, I also wanted to say, as we're talking about how we can include FGS into the curriculum, the mainstream, for example, Minister of Education curriculum could be a challenge and could take long. But maybe let's be looking at opportunities such as when we know that some implementation tools like PA education manuals, etc., are about to be revised. Let's seize that opportunity to start advocating and planning to make sure that we include FGS in the next implementation tools that we are developing. Because issues, of course, are going to come in, and where we can just integrate in existing processes, that would also help to make sure that we push FGS in the national implementation tools, guidelines, and strategies. Thank you.
Thank you so much, Simon, for this brief recap of the last questions and comments. Very insightful from your side. Thank you. Leora.
I'll be really quick, but I think from our perspective, we're really, really grateful for all of the engagement and all of the questions, and really all of your insights into some of the gaps and some of the things we also need to work on. I think we can definitely share country-specific research, which Natasha flagged for Zambia particularly. We do know of research that's been done in particular countries that we can most definitely share. And it would actually be fantastic to do country-specific calls where we delve into FGS in each country, you know, who's working on FGS in those countries and what are some of the opportunities coming up nationally. Because the approach for FGS, particularly with the Global Fund, will need to be very specific and contextual per country. So whilst it's been amazing to be together now, it would be really beneficial to have country-specific conversations so we can go deep into the country and what are some of the opportunities, what exists, and who's working on what, to see how the advocacy for FGS can be pushed forward for the Global Fund in the next year. And I think it's also particularly, you know, important for Malawi, Simon, to just keep pushing, even though there is the German investment, to make use of the momentum that's happening in Malawi now. So I think that's it from me. And Angela, I think we'd touch base with you on how we go about that and how we send the research to each country. But I just want to flag that we're really, really grateful for your engagement and your energy and your hunger to learn more and understand about FGS and advocate for it. And oh yeah, I'm really excited to continue working. I will hand over to Yael because she'll also mention about a study that's being released that we can also link you into as findings get released. Yael?
Thanks, Leora. Yeah, just to mention that there's a lot of research happening at the moment on FGS, as I said earlier, and also the burden. So there's a large-scale burden assessment of FGS that's funded by the Gates Foundation happening at the moment. And I think Tanzania will be the first country for which data will be made available. And that will happen at some point this year. We're not quite sure when, but FIG members are involved in this study. So let's stay in touch and make sure that we're sharing this information as it becomes available. And I also just wanted to emphasize that all the points that were mentioned, for example, around disability inclusion and challenges with capacity at the healthcare facility level and even at the ministry level, these are all really important reality-based issues that will need to be taken into consideration by the World Health Organization as they continue to develop normative guidance on this. We were told this morning by WHO that there's going to be a technical consultation on FGS taking place around April this year. So we'll definitely be feeding in these points, but please also be ready to respond as we reach out to you for consulting on some of these aspects and on drafts that are being developed. Because if the materials that WHO produces doesn't reflect these on-the-ground concerns, it's not going to be very valuable or implementable. So thank you so much for your input.
Thank you, the FIG group, Simon, Yael, and Leora. And I would just want to close up this session with a very important message that this is the first initial meeting. We will have context-specific, we'll have country-specific meetings too, and we will be having other sessions for informative advocacy tools that we'll be sharing with all of you. Just like for a final reminder, we'll be sharing the meeting report with all the resources, materials, and presentations, and also contact details for the panelists that we have had today. And I just want to thank also our communication team. Thanks to the Flourishers, thanks to the national focal points in Zambia, Nigeria, Malawi, Ghana, and Tanzania. Special thanks also to Malawi and Ethel for organizing and moving the advocates on the ground. And I keep the hope open to have more informative sessions and more conversation around this topic, and absolutely a happy new year of gender equality and HIV comprehensive services to all. So please reach out if you have additional comments. You have our contacts, and we will be sharing this report very, very soon in the next weeks. And happy new year to everyone. Thanks for joining us in today's meeting.
Thank you, everyone.
Thank you
so much.
Thank you. Bye.
Bye.
Thank you.
Bye, everyone.
Goodbye.
Bye-bye.
Bye.
I just saw, sorry, I'm just hanging on because I just saw a message from someone, so I'm just trying to check.
I think it was Linda. Linda, you're
Yeah.
still here. Yes. We are recording all, Linda, and we will share the context through your WhatsApp too.
Okay.
All right, thank you.
Thank you, Linda, for your participation.
Thank you, Linda. Thanks, Angela. We'll be in touch.
Thank
Fantastic.
you. Thank you. Have a nice day. We'll keep on. Bye-bye.
I appreciate it. Bye.
Bye.